My name is Amanda Utesch with Missouri State University. I am going to be talking about parental substance abuse and recurrent child maltreatment. An important risk factor for recurrent child abuse is the illicit use of substance by parents. About 1/4 of cases of recurrent child abuse in the welfare system in the United States includes parental substance abuse. Recurrent child abuse is extremely common. Most cases that are in the welfare system are secondary or even third child abuse cases per parent. And alcohol is still the most abused substance amongst parents in the United States, due in part to the fact that it is legal, easy to get, and socially acceptable. Children of parents who abuse substances are more likely to live in poverty. A lot of times, substance use is a reaction to poverty, or poverty is a reaction to substance abuse. Either way, most of the time, children follow their parents into that lifestyle. They're at higher risk for malnutrition and more likely to suffer from medical neglect. A lot of times, children of parents who use substances will come in and they will not have been eating the proper foods, or they might have untreated cavities or be unvaccinated. They also might be severely underweight or suffer vitamin deficiencies due to lack of nutrition provided by the parent. Children who are exposed to parental substance abuse are more likely to become homeless or live in unlivable living conditions. A lot of times parents cannot afford to feed their habit and to keep a healthy and stable home. They may not have electricity, or the child may not have clean clothes, or they might have recurrent head lice. Recurrent head lice is extremely important in identifying child neglect. Schools usually find it, and it is often reported if it is not something that is taken care of, or it's something that is a common occurrence with one child. They are also at higher risk of being left unattended or unsupervised at inappropriate ages. A lot of the times that parents will go on binges, they will often leave their children unattended. They may leave them with caregivers or family members, or even they might leave them to take care of younger siblings at ages that would be deemed inappropriate, like 7 or 8, so that they can go out for days or hours to use substances. Parents who engage in substance use in the home are at higher risk for aggressive behavior in domestic violence situations. This is especially true in the case of alcohol. A lot of times alcohol can cause aggression, and this might be taken out on a spouse or a partner or a child. And it's easy to become aggressive when you consume massive amounts of alcohol in a short amount of time. Since child abuse isn't always physical abuse, seeing emotionally violent relationship between your parents or experiencing one yourself can cause a lot of psychological issues in child development. Children who are exposed to parental substance abuse are more likely to develop immature coping mechanisms later in life. This is due in part to modeling. If a child sees a parent use alcohol to cope with life stresses as they get older, they're going to think that that is how you cope with life stresses, and that addiction may become hereditary or passed down at that point to the child because they have not been taught a better way to cope. Parents who abuse substances are more likely to emotionally neglect dependent children throughout crucial periods of emotional development. This is exceedingly true in the instances of infancy. Infants often need a lot of emotional support, and parents that are using substances cannot provide that adequately. They will often emotionally neglect the child, or not soothe the child, or kind of just not be there the way that they need to be due to their addiction. This can cause severe issues later in life when trying to form bonds with other people or future relationships. It might be really difficult for that child to form attachments. Children of drug-addicted parents are more likely to develop psychological disturbances throughout childhood and adolescence. Substance abuse disorders can cause mood swings and irritability, fatigue, restlessness. All of these things can cause anxiety and depression in people that are around these individuals. They might feel like they're walking on eggshells. These children might have a hard time sleeping, or they might be very timid when they come into the system. Children that are exposed to substance abuse are also more likely to experience severe behavioral problems. A lot of times in young children, this can often be misdiagnosed as like ADHD or ADD, when really they are just acting out like behaviors and feelings that they cannot express otherwise because they have not been taught how to express themselves. So what is being done about substance abuse disorders in parents? Well, family drug treatment courts have been gaining popularity in the last decade. Family treatment courts are specialized court systems that focus solely on children's division cases. These are not usually criminal cases. These are usually child abuse or neglect cases that are a result of substance abuse disorders. The participants are required to attend drug and alcohol treatment programs, and they undergo regular drug testing. A lot of times, they will be required to do AA or NA or go to group counseling to help better cope with their addiction. Many participants in family treatment courts have children that are removed from the home, and they're working towards reunification. So in some cases, the children are still in custody of the parent while they're going through the program, but in more cases than not, they are already removed and the parents are working towards regaining custody of the child. The programs typically average about 12 to 18 months, depending on individual needs of the parent and child. Children might receive services such as play therapy, or they might have a guardian ad litem that will help the reunification process, because a lot of times children will have psychological issues pertaining to the parental substance abuse that needs to be addressed before they are brought home. But are these courts effective? Well, research has shown that treatment courts offer individualized treatment plans that are more beneficial to parents than other treatment options. The family drug courts are very individualized. It's not a one-size-fits-all, so what might help one parent might not help another. So they really try to focus on individual needs, which is extremely beneficial to recovery. Treatment courts provide a sense of accountability to a parent, which is a huge factor in substance abuse disorders. They oftentimes have a hard time accepting responsibility, and this teaches them how to do that and how to cope with having to do that. Research has shown that parents that go through treatment courts are less likely to have children removed from the home after reunification. Since most child abuse cases are recurrent cases, parents that go through this program are less likely to have them removed again, which means that they the program itself has everlasting effects on the parent that are beneficial to raising children. The research shows that children who have been removed from the home are reunified with parents faster than those who are not involved in treatment courts. So a lot of times parents earn the right to their children back faster than parents that do not enter these programs. And they provide consistent visitation schedules with participants. It keeps the parents motivated to treat their addiction as kind of like a token economy. They really think it's important that children have a connection with their biological parents, which it is when possible. So these programs are very good at keeping visitation schedules and making sure that that bond is strengthened before coming home. My final thoughts on this is that substance abuse among parents has an everlasting effect on a child's psychological, physical health, and well-being. Since it is a huge risk factor in recurrent child abuse, I think that the key to preventing recurrent child abuse, it lies within effectively treating substance abuse disorders in parents. I think if we can treat the underlying issues that are causing the substance use disorders, we might have a better chance of long-term recovery and better child abuse outcomes. Family treatment courts are really an excellent tool, and it's aimed to prevent the revolving door of child protective service participants and the foster system. They really make a point to try and reunify parents and children to provide a better life for the family as a whole, and I think that's very important.